While there are several types of Medicare coverage, the two that can be the most confusing are Medicare Advantage, also known as Part C, and Medicare Supplement, also known as Medigap. While both pay for expenses not covered by Original Medicare, you cannot be enrolled in Medicare Advantage and Medigap at the same time, and there are several important differences between the two plans to know if you are looking to enroll in Medicare. I'm Gina Schreiber, president of AVO, and our experienced team can help you enroll in a Medicare Advantage or Medicare Supplement plan. It's important to us that our customers not only get the coverage they need, but that they feel informed and supported in the selections they make. So we hope this video helps you better understand the differences between Medicare Advantage and Medigap, so you can feel confident in your Medicare decisions and select the coverage that you feel truly fits your unique needs. We'll start with Medicare Advantage. Medicare Advantage plans, also known as Medicare Part C or MA plans, are a solid alternative to Original Medicare, combining Medicare Parts A and B and often Medicare Part D prescription drug coverage. These plans may also include great additional benefits like routine dental, vision, and hearing coverage. Because Advantage plans offer affordable, comprehensive coverage in a wide variety of services and specialties, they may be a better option than Original Medicare for someone requiring specialized medical services. Now that we've covered the basics of Medicare Advantage, let's talk briefly about Medicare Supplement plans. While Medicare Advantage is intended to be an alternative to Original Medicare, Medicare Supplement or Medigap plans are designed to be purchased separately to work with Original Medicare. Despite all the benefits of Original Medicare, it does not cover all the costs associated with healthcare services and supplies. Medigap helps cover potential gaps in coverage, including coinsurance, deductibles, and copayments, which can add up fast. When making your Medicare selections, it's also important to consider that some Medigap policies cover services that Original Medicare does not, including coverage while traveling outside of the United States. Still, Medigap does not cover long-term care, vision, dental, hearing aids, eyeglasses, or prescription drugs. Depending on your unique needs, these added benefits could help you decide what type of Medicare plan you want. Now that we've gone over what Medicare Advantage and Medigap are, you may be wondering which one is better. But the answer to this question will vary from one person to another, since everyone's healthcare and financial needs are different. That said, there are some helpful ways to compare Medicare Advantage and Medigap, starting with costs. Medicare Advantage plans may have very low or no cost premiums, but in exchange for $0 premiums, enrollees may have copays, even for visits where they previously weren't required. Meanwhile, Medicare Supplement plans incur higher monthly premiums but involve low to no copays for medical services. Additionally, Medicare Advantage plans can be financially effective since they can often include dental, vision, and hearing care options. Since Medigap plans do not include these benefits, you would need to purchase coverage for these services separately. Similarly, prescription drug coverage is included in many Medicare Advantage plans. These are known as Medicare Advantage Prescription Drug or MAPD plans, but there are no Medigap plans that include prescription drug coverage. This means anyone who enrolled in a supplement plan will need to enroll in Medicare Part D separately to receive coverage for their prescription needs. Another important factor to consider is who you see for treatment. Medicare Advantage plans may require you to use in-network providers, but Medigap plans do not typically impose network restrictions. This allows individuals with a Medicare supplement plan to see any provider who accepts Medicare. Before we wrap up, one last thing to consider is keeping track of your Medicare card, or cards. If you enroll in Medicare Advantage, you will be able to use one Medicare card for all services you receive, including prescription drugs. Alternatively, separate Medicare cards are required for Original Medicare, Medigap, and also for Part D coverage. While everyone's needs are different, the convenience of only having to keep track of one card could make it easier to decide between Medicare Advantage and Medigap. Ultimately, there are many factors to consider when deciding whether Medicare Advantage or Medigap is the right choice for you or your loved ones. If you would like to discuss this subject further or have additional questions about enrolling in Medicare, please call AVO today at 877-406-5160. Our licensed agents can offer trustworthy guidance and great customer service as you navigate the wide world of Medicare. We are here to help and look forward to speaking with you.